When Hassan was born, doctors said he didn't have much chance to survive. The 4-year-old was born with dextrocardia, a rare condition in which his heart is pointed to the right side of the chest rather than the left.
The first time we came here, he was just 1 month old. He was functioning at 1%. Now he's at 80 to 90%.
Hassan and his father Mahmoud have been coming here to the Sheba Medical Center outside Tel Aviv every month since he was born. That's not an easy feat, as Hassan's family lives in the Gaza Strip.
When I first came here, I didn't understand anything. I didn't know the language, nor the severity of his condition. But then I got used to it. I began understanding his condition and used the little English I know to get around. That made it easier.
Hassan has spent the last 4 days in the hospital, as he's expected to get a cardiac catheterization.
The doctors say there's hope for Hassan, although we know he'll never be 100%. After today's procedure, where doctors place a small tube into his heart, we'll know a lot more.
Hassan is one of hundreds of Palestinians who receive medical treatment in Israel every year, with Sheba treating the majority of them. Like 13-year-old Fatima, who lives in the East Jerusalem neighborhood of Beit Hanina. Her mother says she's thankful Fatima is being treated in Israel.
All the people that I know get the treatment from Israel. So I don't think that anyone has. They say that it's better, okay? Every person I know say that it's better to get treatment from Israel because the doctors is good.
Last month, Fatima received a heart transplant, and she's back for a routine biopsy checkup. But there's one thing she misses the most.
Go to school.
Go to school? What do you like to learn at school? What do you like at school?
Science.
Despite missing this school year, the hospital provides a tutor for Fatima, and she gets some studying done at home. Doctors say she'll be able to return next school year.
She does have to come for a lot of tests, just to have a lot of echoes and lots of blood tests, and take regular tests to take little pieces of the heart muscle to make sure that her body is not rejecting the new heart. You know, we try to think about her and make it as easy as possible for her, and we're happy. It's a great success story.
None of this would have been possible without the hospital's regional patient unit, which coordinates the treatment with the Palestinian Authority.
For many of the patients, this is their first encounter with Israelis. Naturally, at first they are a little ambivalent and suspicious, but they are really wrapped in support here. For us, it doesn't matter who they are or where they come from. We treat everyone equally.
Baloum, an Arab Israeli from the city of Taibe, has been serving for the past decade as a bridge, connecting the patients for whom the PA can't provide the treatment but pays for it and the hospital.
The way I see it, true peace, without any political considerations, is here, in this hospital.
Later that afternoon, both Hassan and Fatima underwent successful procedures. Their stories are just 2 examples of how medical treatment can overlook political differences and remind us of the important things in life, and that's life itself.
I come here to bring my son for treatment. We don't get involved in anything else. The cooperation here is great, and not once have we gotten into any kind of trouble. I was actually very surprised by all this. At the end of the day, all we want is to live.